Welcome back. In recent news, New York City Mayor Eric Adams issued an executive order declaring a local state of emergency in response to the monkeypox outbreak. Now, the center of the 5 boroughs has become yet an epicenter for another health crisis. With cases in New York City rapidly increasing, many people are not properly informed of the virus. And joining us now to give us more details and bring us more light on this situation, we're pleased to have the president and chief medical officer at AdvantageCare Physicians, Dr. Navarra Rodriguez. And Dr. Rodriguez, thank you for joining us here.
Thank you for having me.
Well, as I said in the intro, a lot of people are still in the dark when it comes to monkeypox, and we're hearing more and more about outbreaks. But first and foremost, let's get our viewers acquainted with what exactly is monkeypox.
Absolutely. Monkeypox is a virus that is often transmitted through close physical contact, and it can cause rashes, blistering type lesions, often on the hands, the face, the genital regions, and it can be quite painful. It's not a fatal disease, thankfully, but it is one that's quite uncomfortable, and we've seen rising cases here in the New York metro area over the past several weeks.
So when we look at this, how does one go about contracting monkeypox? Is it something that, is there any particular method or way that this is being contracted now?
Yes, we are seeing that monkeypox is being transmitted through very close physical contact, skin to skin contact predominantly, as well as large respiratory droplet transmission. And so we do want to really caution individuals to be aware of close physical contacts with individuals who have monkeypox type lesions, rashes, blistering rashes, especially in the genitals, the hands, the feet, the face, etc. But monkeypox can also be transmitted through fabric content, so used bedding or towels. So we want people to be aware to minimize their risk of transmission for monkeypox is to avoid close skin-to-skin contact, bodily fluid contact, and fabric content with those who might be infected.
And so when somebody looks around and says, I don't know the signs or the symptoms, what can one look at to determine this could potentially be monkeypox?
Well, I always encourage people to have who have questions or concerns about exposure to monkeypox or other viruses to connect with their primary care physicians at AdvantageCare Physicians. And as we think about our family companies of Emblem Health, we want people to be educated and to look for resources of information. Our websites at AdvantageCare Physicians and Emblem Health have updates around signs and symptoms of monkeypox, what to look for, but also the New York State and New York City Departments of Health provide that information as well. I always encourage people to be on the lookout for anyone, close contacts who may have rashes, again, blistering rashes, because those can also be indications of monkeypox virus and infection.
And for one who may contract it, I guess the question is, where do I go from here in terms of treatment, and how long will one have to really deal with this monkeypox? If they contract monkeypox, how long are they dealing with the virus?
Well, with anyone who has any kind of physical symptoms, either rashes that they are concerned may be monkeypox or flu-like symptoms that can also be symptoms of monkeypox or other illnesses, they should connect with their primary care providers or healthcare providers to ensure they get adequate testing and it can have the management of the virus moving forward. We see that the virus usually presents symptoms within 3 to 6 days of exposure and can last up to a few weeks as well post that exposure. So being connected with a primary care physician is essential when anyone is concerned about their health.
And I know treatment is done with yet another vaccine, and I know New Yorkers and people across the United States are saying yet another vaccine. But give us some insight into the vaccine and who should be vaccinated.
Well, anyone who has been exposed to monkeypox or fears that they've been exposed to monkeypox should be vaccinated. We've seen initially that the initial cases here in New York and in the US have been predominantly amongst men who have sex with men. But monkeypox is not limited to that community alone. And so I do want to encourage anyone, adult or child, who may have been exposed to monkeypox to seek care with their healthcare provider and to seek the vaccination to help minimize the effects of the virus and minimize any pain or discomfort that is associated with the virus. We do
And for
have
your,
these
good, okay.
we have seen over the past few days expansion of the supply of monkeypox virus that's available in New York City and different administration of monkeypox virus to ensure that there's a broader supply to anyone who's been exposed and at risk.
Yeah. And as a practitioner, I want to ask the question for yourself. Are you finding more and more people are asking questions or seeking information? Because there are a lot of people, as I said in the beginning, who are still out in the dark.
Yeah, we are seeing a lot more questions. At AdvantageCare Physicians, our website gets updated with information as we hear about it and see it so that our patient base can be educated and have a source of knowledge with emerging risks from different viruses like monkeypox. And so we are seeing a lot of questions, and I do commend the team here for bringing more information to the public around this greater risk.
Yeah. So we talked about those who can get the vaccine. Are there others who may not be able to receive the vaccine due to health issues?
So we are not limiting who can't get the vaccine. We do want to make sure we're prioritizing individuals who are at risk of exposure or have had exposure, who may be immunocompromised and have weakened immune systems and more at risk for contracting the virus, to prioritize those individuals to get the vaccine. As the supplies expand, we expect more and more people to get the vaccine across New York City.
Is there any common stereotypes that we're hearing about this that we might need to debunk right off the bat?
Absolutely. Because the initial cases were seen in men who had sex with men predominantly, there were the stereotypes that this is purely a sexually transmitted disease and only limited to those individuals. Viruses can change and morph and are not limited to one community versus the other. And so everyone should take precautions with regards to monkeypox and pay attention.
Yeah, yeah. Are there months that are peak for this in terms of like the summer being a time that we have to really pay very close attention as opposed to the winter, or is it seasonal? I guess the question I'm asking.
I would not say it's seasonal. And as we've learned through the pandemic, things can change on a dime and viruses emerge and change as well. So we want to highlight, we're seeing rising cases in New York City and New York State. At this point in time, everyone should be aware and on high alert and work towards minimizing transmission, protecting themselves, and ensuring that if they have concerns, they're connecting with their primary care providers.
For those who have been affected, I know there's a concern about the reinfection rate. What is the possibility of being reinfected once a person contracts monkeypox?
I wish I could give you straight answers around that, Daren. I think as we see how we manage through the vaccination effort to minimize reinfection and minimize exposure and risk, we will see emerging trends and be able to manage this virus more effectively.
Yeah. Were you surprised when you heard the fact that New York City is now becoming the epicenter?
I am not surprised. New York City is a hub for a lot of great activities. It is an international city. We are at high risk for a lot of things. But the great thing about New York City residents, especially as we've emerged from the pandemic and as we work with state and city officials, departments of health, and community organizations, is that we're a city that can take action quickly if we pay attention and understand that we have personal responsibility.
Yeah. A lot of people are wondering, is there a possibility that there could be a risk of a larger outbreak given the fact of what we're seeing right now?
There is always a risk of a larger outbreak, but this is why education is so important. For us to do the things that we've learned to keep our community safe, washing our hands, limiting areas where we may be exposed to dangerous viruses, taking care of our health, connecting with healthcare providers, and really managing chronic conditions and other health issues that may put us at risk for infections or other exposures. We can combat monkeypox just like we're combating COVID and making sure we're minimizing exposure during the seasons with flu and other viruses. We just need to pay attention, protect ourselves, stay educated, and take action.
What's it been like for you? I mean, obviously dealing with the COVID-19 pandemic, we're still not out of it yet. We still got, new things to really worry about and be concerned about. Then you couple that with monkeypox as a healthcare provider yourself. What's it been like for you over the past few months?
I can't say that it has been easy for healthcare providers, but viruses emerge all of the time. And as healthcare providers and as a community, we're constantly facing a variety of challenges. We just need to stay abreast of them, keep up with the science, and be engaged with our Department of Health officials and other organizations to ensure communities that need support and access to healthcare get them. That's the focus for us at AdvantageCare Physicians and at Emblem Health. We want to make sure communities that may be at risk for different viruses or have different concerns about their health have a place to go to seek care, to get education, and be supported to get through these pandemics and viral exposures and any other challenges in our healthcare system that we will face going forward.
We covered a lot of things, but before we go, one issue that I did not talk about was that of those who are pregnant and you have monkeypox. What are the complications? Are there any potential complications for a person that may be pregnant?
There is risk because the monkeypox can be transmitted through bodily fluids and direct skin contact. So there's some risk of exposure to an infant during birth from an infected mother. For everyone, if they're pregnant, not pregnant, if they have symptoms of monkeypox, they should be working with their healthcare provider to ensure they're minimizing transmission to their family, their loved ones, their community, and making sure they stay safe and can get through this with the support of others.
Yeah. Dr. Navarra Rodriguez, thank you so much for being with us. Great information that you shared with us with regards to monkeypox. Of course, we want to make sure that people see their healthcare provider if they have any symptoms and take advantage of the resources. And I know that you've got some great resources in your network right there. Thank you so much for being with us.
Thank you very much. Have a great day.
All righty. Well, we want our viewers to know now, if you want more information, please don't hesitate. Visit the website at emblemhealth.com and then also the website acpny.com. We don't want you to go anywhere. We are continuing. Open continues right after this.